behind the door. This is where I first discovered what we've put together in Galong. Yes, you can't believe it, I know, but one flat after another looked like this. I couldn't believe it when I saw it. And inside behind the door, I saw the most awful social deprivation, people without money, without families, without jobs, without bus fare, without teeth, everything swallowed up by the drugs. But the thing that struck me most in this door knocking was the women's situation. And especially I was learning that they didn't have their children with them. And it wasn't just one child, it would be a woman with 1, 2, 3, 4, 5, 6 children not with her, in care somewhere. So the plight of the women was what I honed in on. My attention was focused on the plight of these women. Take the example of Prue. And Prue is typical of the cohort that we hope to help at the farm in Galong. I saw Prue walking on this public housing complex. You may be aware of Gary Court, all pulled down in the last week. And she was heading towards one of the most dubious flats on the block. So I sidled up to her and I introduced myself and I said I knew the person who lived there, we'll call him Max, to be very careful and exchange phone numbers with her. Nevertheless, she formed a relationship with Max, who introduced her to drugs, who locked her into his flat, more or less kidnapped her, and she eventually became pregnant to him. Now, the only way she escaped from this in slavery was when she was pregnant. The complications in the pregnancy meant that she had to go to hospital early and be hospitalised. So what happened then? The services kicked in. She's taken off the margins, and as the saying goes, when people walk onto the margins disappear. So services kick in. Not only doctors and nurses, but she's now receiving care from a mental health social worker and a psychologist. This is a woman of 35, but for the first time in her life, the problems that have created this mayhem around her begin to unravel. And again, unfortunately, this is typical of the cohort that we want to help. Sexual abuse from the age of 3, domestic violence in the home, an alcoholic mother, alcohol herself at the age of 14, a propensity to attach herself to dangerous men, meaning she has not only this child, the last child, but 2 other children in care, and all the mental health problems that follow from a life lived like this. The women I meet are often saying, oh, I went to the doctor and he's put me on antidepressants. And I say, you're not mentally depressed, you're sad because you've had a terrible life. Basically, that is what it is. This terrible condition that these people are living in, and it's one person after another. So in the case of Prue, what happens to her when she leaves the hospital? She's here, everything's fine, she's had the baby, a nice healthy boy, and she's on the doorstep of the hospital. Relapse. That's the word you often hear going side by side with the word drug addict. In the case of heroin and alcohol, the recidivism rate is 90%. 90% of people just go back. Rehabs will tell you that their recidivism rate is 80%. This is where Prue needs the farm in Galong. So our model is that these people have been suffering in such a devastating way for so many years, they need a form of retraining. They need to relearn life. This is what the farm is there for. It's more like a vocational centre than a rehabilitation centre. They have to learn life. So they will come for a longer period of time than they would normally go to rehab, and they will retrain. They will get the ability to access a house, the ability to be trained so that they can be employed, the ability to gather around them a support network, because one of the biggest things that causes this recidivism is there is nowhere else to go. It is truly an underworld out there in Canberra. There is nowhere else to go. So we do things like working bees where they meet people. They like old lady for some reason. They meet people in the community and it develops them. And this is how they're getting a permanent recovery. That's what the farm aims to give them. There's nothing else that they need but permanent recovery. There's no point in, if you go to hospital and keep going back in It's not working. Something's not working. So we hope this model is going to be different from what they've experienced in the past. A job, a house, a support network. That is what Prue needs, and that is what the farm will provide for her. But most importantly, the chance to be well again and get their children back. So this is the big thing for the farm in Galong, that the children are returned to them and they are happily bringing up their children in the dignity that they should be, that they're really deserving to have, the dignity that they were born with, that they should be able to have. So tonight, the three things that I think in practical terms you can help us with are staffing of this new facility. We need $50 a night for counsellors to be there 24/7 with the girls, because when night falls, people fall. The post-traumatic stress that all of them will come with gets very alive at night, as you can imagine. So we need people to cover that and make sure they're provided with or cushioned at those dark hours of their existence. The second thing we need is a good psychologist. They're a random and varied group, psychologists, especially one who is trained in the method that we're using, the therapeutic communities method. And we have a woman who's willing to do this. That is $100 an hour. So $100 an hour will buy a girl a reprieve from this mental torment. That's what we're hoping with this sort of treatment. The third thing, the land is very beautiful. It's a 3-hectare property with an old convent that we've renovated, and we want to get that therapeutic intervention from the land, yeah? So we want to get them a kitchen garden and an orchard so that they can start working for two reasons. We want them to be able to get their hands dirty and be in nature, but we also want to be getting them into the work skill. TC method is about reversing all these habits. So a drug addict gets up at 12 o'clock in the afternoon, grumpy. The first thing they do at the TC is they go to church 7 o'clock. And I know how to get people into church at 7 o'clock. So it's a reversal of their previous lives, yeah? That's what the farm hopes to achieve. So you can help restore the lives of these women.